Hi, my name is Prosper Mandela, and I'm a PhD student at Laurentian University. Today, I'm here to present my abstract on an unmet global agenda, COVID-19 vaccine hesitancy in northern Ghana. This is part of my PhD project, and this with disclosure of affiliations and financial and in-kind support. And I have no relationship with for-profit or non-profit organizations. And this session and program has not received any financial or in-kind support. The study on Unmet Global Agenda on COVID-19 vaccine hesitance. Basically, despite Ghana having sufficient vaccines to inoculate about 88% of its eligible individuals, at least we have about 42% of Ghanaians who have received the COVID-19 so far, and there's also 42% vaccine hesitancy recorded per studies. So this study basically sets out to explore the strategies that will promote vaccination in northern Ghana. And then this study employed a descriptive qualitative study design, and it also included stakeholders such as the directors of health, public health officers, disease control officers, health promotion officers, and then some traditional medicine healers who have a stake in decision making in health. In total, we interviewed 17 stakeholders, and these were basically through Zoom calls, and each interview lasted for 30 to 45 minutes. And the analysis was based on a reflexive thematic analysis using NVivo. And out of this analysis, 5 teams emerged from the study. And the first team was the organization of the vaccination programs. And the program or the strategies employed by the stakeholders basically was about radio station announcement and some through other medium of communication to propagate the message about the availability of vaccines. The next one was also about the organizational support for vaccination programs in northern Ghana. And this talked about the partnerships between NGOs and the Ghana Health Service on how to promote vaccination in the northern regions of Ghana. And some organizations such as Global Communities and CRS were involved. The third team talked about the proposed strategies that would enhance vaccine intake. And then we're talking about how people moved from the usual stationary or static clinics to basically house-to-house visits. And then the fourth strategy and the fourth thing that was also observed was about the challenges encountered during the vaccination program. And these were basically about how logistical challenges. And then the feed team was about the exploration of herbal medicines as an alternative. And this was stated by the traditional medicine healers. And they looked at it from the perspective that COVID-19 is something that they have experienced before, and they felt that there's no need to take the vaccine. And then based on these studies, we look at the conclusion and we highlight that the stakeholders' preference for home visiting over stationary programs. And then we believe that there should be specific evaluations to be conducted in peculiar terms of logistical need and support for future vaccination programs. And then we also, the key message for this whole study is to drive home the need for house to house or the home visiting um, vaccination program, especially targeting people who live with disability in northern Ghana. Thank you so much.